I'm a registered nurse. I've been in nursing for most of my life, which is a long time. At any rate, when I approach the whole subject of skin and wound care products, I approach it as a generalist. Even though my specialty is in psychiatric mental health nursing, I am very passionate about treating the skin because it is the largest organ of the body. And if you can appreciate that, it's our defense system, it's the outside covering, and if we don't have that intact, we have the potential for infection. And if you have any experience with infection, you know they can be really quite nasty and also transmit problems and communicable diseases to other people. So we want that skin to be intact. And how intact is it? It's quite a mystery, isn't it, that we have all of these patches that deliver medications through the skin, and yet we are kind of like pretending that it's got a good barrier. Well, if there is a break in the skin, we want you to discover that on the initial assessment of your patient, and then throughout the hospital stay or wherever you were at, to make sure that the integrity of that skin continues intact. It's especially hard with older generations, and so the quality of your skin and wound care products is very important. There are on the market at least 37 companies that market various products to cover the skin, take care of wounds, and some of them may not have the vast range that the Smith & Nephew product line carries. I'm proud to know that the hospital and all of the entities that the hospital that I work for is connected with carry the Smith & Nephew products. And if you are able to work with your product manager and identify which products might be most useful to your institution, that keeps the cost down. For sure, there are expiration dates on all of the products, or the majority of them anyway, and so we don't want them to expire and just go to waste. So if you keep the product line small enough and yet large enough to cover the range of problems that you see, that is so important to the facility that you are working in. So again, at the place where I work, it is a psychiatric hospital, and all the products that we generally would be finding useful are contained in a little shoebox size box that's called wound care. It's got wound care on it, and so the 5 areas that you might be working in, inpatient areas, do have that available to all of the staff. All the boxes have a latch. I want to point out to you that I put together a laminated sheet that contains all of the products and how they are most useful, and the older products that they can also replace, such as, for example, stereo strips and adhesive tape. If you've got product lines that have an adhesive margin around the edge of the dressing, you will not need that adhesive tape, so at least in very few circumstances. So read this over. I'm asking all of the employees that I work with to take a look at this cheat sheet, so to speak, and see what product would be useful for the problem that your patient might be facing. The next thing that you might be using is the No Sting Skin Prep, and those are little pads. If you have a wound and you're going to fasten the dressing to it, take a pad, rip it open, and swab the outside of the margins of the wound so that you've got the perimeter of the wound covered, and the adhesive section will stay much longer. And a lot of these dressings, they are made to stay intact for 3 to 7 days. So it's not something we're going to be changing every day. We don't do it 3 times a day, dressing changes on these type of products. Okay, I'll explain those type of dressings that I have fixed on there in a little bit. If there is external fresh wound, let's say one of the patients was outside, they stumbled on the sidewalk, they've got some granular little pebbles or something in their knee, for example, you would use this product called Dermal Wound Cleanser. You can also use it for patients that are newly coming in, you're assessing them, they've got some maybe scab and skin that's just ready to peel off. You can use the Dermal Wound Cleanser and it explains, you know, how to do that on the outside of the bottle. There is a forceful stream, and then there's also a finer spray, which can be used. And then you can use your standard 4x4s to finish the process of cleaning. But in general, let the wound air dry after applying the wound cleanser. Excess drainage, you can use that 4x4 sponge to swab it off just on the perimeter, and then do not touch that wound, because you're going to either be applying medication the doctor's ordered, or a simple salve like a bacitracin if it's a fresh wound that, let's say, somebody stumbles and has a you know, exposed area of the skin has come off, and you want to clean it. The products that are in the box, there are very few. We have several sizes of the Elevin Thin. It's a Smith & Nephew product. This is the 3x3 size. No, this is the 2x2 size. So that would be applicable, for example, to a skin tear. I'll show you pictures of how that would be workable. And then the larger size, that might be useful to an area that has cellulitis that's breaking out. The other products that are not, I don't have in an envelope, these are the thicker Smith & Nephew product called Elevin Foam Adhesive. So there is a pad of sorts. It's several layers thick, and there are antimicrobial products on that foam portion. So if you've got exudate, the wound is going to be secreting the exudate. It might be yellowish, grayish, maybe even reddish, but that will absorb. And there are studies that Smith & Nephew has done that show the absorbing power. It can hold quite a few ounces of liquid. So this is the larger size and the smaller size of the same product, Elevin Foam Adhesive, again with the pad. And as you take it out of the envelope, use your skin prep, put this in the center of the wound, and then tear the backing off. This is an example of the Elevin Thin. It is extremely thin, but again, it's just for surface wounds, nothing that's too deep for secreting anything. And the last type of dressing that is available is the one with the silver backing. You can kind of see the silver cast to it. These are the Acticoat dressings. There are quite a number of various products that Smith & Nephew has. This is called the Acticoat 7 that's supplied in our little box. This is appropriate even to if you have a wound that needs packing. This can be packed right into the wound. It is so wonderful. Of course, it's a sterile dressing when it comes out of the envelope, and it has antimicrobial and antiviral properties. It is very effective against what we know as the superbugs, the MRSA, the VRE, the superbugs of the communicable diseases that we often have in hospital. This will pretty much be your first line of defense. The silver dressing. You may be familiar with Silvadene cream. This is several times over more effective than the Silvadene cream because of the rate at which it works and the particles that filter into the wound itself to produce the antimicrobial properties. So Acticoat 7, very, very wonderful, as well as valuable and pricey. The prices might range for a size like this. 4x5 dressing can go anywhere from $20 to $60 if you look online, depending on what company or what vendors are promoting it. That is something else to think about. So you don't want to just casually open it and say, oh, I don't think I need that dressing. Be very choosy about that. The other item that you might see and wonder about on this particular poster is measurements. We measure from head to foot. That is the length. And so use your paper tape, and the head to foot dimension is the length, and then left to right or right to left, it makes no difference which side you start on. is going to be the width. And the depth can be obtained by using a Q-tip, and you would probe the dimensions of the wound and measure that against the paper tape when you take that Q-tip out. So that would be your depth. So that's what's illustrating the box contents. And now for a very brief presentation on examples of actual people that have had wounds. And this one I have quite an interest in because there was a physician ordering in our facility, physician ordered dressing change 3 times a day. And we had several years back a different company, but it was like a bio-occlusive dressing.
Can you take a call to House Supervisor?
Illustrate. You use the pictures.
Hold on.